My name is Prem Kumar Shanmugam, and I'm from Solace, Asia. We are a private addiction treatment specialist facility located in Kuala Lumpur, Malaysia.
I am a senior dietitian currently working with Pusat Medical Center, and I'm also currently the Assistant Honorary Secretary of the Malaysian Dietitians Association.
Hi, I'm Siti Aisyah. I graduated from University of Auckland, New Zealand. I studied in the Bachelor of Arts in Psychology and Sociology.
So my name is Shazliza Zamly. Currently, I'm doing Masters in Clinical Psychology, and right now I'm doing my internship at one of the psychological center.
My name is Katyana Azman. I am the resident child psychologist here at Pantai Hospital, Kuala Lumpur.
My name is Mei. I have been working as a clinical psychologist for today.
Hi, and I'm Yvonne. I'm a registered clinical dietitian. I've been with the Red Clinic for about a year and a bit already.
I've been working in the field of addictions for close to about, I would think, almost 20 years, maybe 18, 19 years, yeah.
I have been working as a dietitian for about 13 years now, and mainly in the private sector. And for the last 10 years, I've been in the clinical side.
I've been involved in this field for quite some time, actually, indirectly. But of course, I'm practicing clinical psychologist right now, officially. But before this, I was doing psychology. When I was doing my degree, I did involve indirectly with this field. I was one of the ambassador for sexual harassment and retaliation in US, and then I did take some of mental health trainings, since there are more opportunities there. So I was studying there, so I took the opportunity and learned more. So indirectly, then I came back here. I worked for 1 year. So during the working session of my working session too, I have bring all whatever I learned and everything, kind of grow it in the company.
In this field officially since 2012, so about 9 years now, but here at Pantai Hospital for almost 5 years.
In my profession overall, maybe about 2 years, 2 to 2.5. But eating disorder wise, I think I haven't really been specialized in this field yet. Because back when I was practicing in the UK, it's actually a specialized, I need to be a specialist dietitian to really see a lot of patients with eating disorder, whereas in Malaysia, I think we're not quite there yet. So overall, I would say I've only seen maybe 2 or 3 eating disorder patients.
As for me, I've been in this field since 2017. Eating disorder comes in not too prominently, but we still deal with them.
First of all, let's try and understand addictions itself, yeah, because eating disorder comes under this family of addictions or compulsive disorders. There are 2 types of addictions. One is known as substance addictions, which is anything that is chemical related or substance related. One more is known as process addictions, which is non-chemical, macam gambling addiction, ataupun eating disorders, ataupun shopping addiction, internet cyber addiction, yeah. Any kind of addiction is a form of a mental health disorder. Artinya eating disorder pun adalah salah satu penyakit yang menyebabkan seseorang itu lose control dan akan jadi terlampau kompulsif di dalam cara-cara tabiat-tabiat makanan dia.
People with eating disorders usually become preoccupied with food and their body weight. And there are certain criteria that is defined by the Diagnostic and Statistical Manual of Mental Disorders. And eating disorders are classified into a few diagnoses, such as anorexia nervosa, bulimia nervosa, binge eating disorder, and also the last category is what we call as OSFAD, or the otherwise specified feeding or eating disorder, in which those are the that category is for those people who doesn't fit the criteria for anorexia, bulimia, or binge eating disorder.
Someone who suffers from eating disorder should seek for proper help, psychological help, if the disorder is untreated, it could get more worse, and it could the person could develop other things as well along the way. Yes, so the symptoms of eating disorder when it comes to anorexia or bulimia or even binge eating, there are different symptoms for 3 of these categories. But in person-wise also, personality trait of person-wise also, it could be different. So tak semestinya semua orang ni boleh, just because of the symptoms ni, you are not falling under that category. That category is just a guide for us to diagnose you basically. But for like say for anorexia, they might be under eating, they might be very afraid of, you know, body weight, body shape, and these are the kind of things that actually make them not eat. And then secondly is bulimia. Bulimia is the one that you eat overly or binge eating, but at the same time you will force yourself to vomit it out. So that also could be that also is eating disorder. And then the third one is binge eating. So binge eating, like the name is means you eat a lot even if you don't feel like eating, you really kind of like just want something to punya. Selalunya these kind of things you would see it as normal, but if this thing persistently happens, then you have to take precaution and have to take note there. Like sometimes people just binge eating, people go like, oh, you memang suka makan, you suka makan. But sometimes you also have to take note there. So there might be other causes to it. It could be psychological factor, it could be genetic, it could be other factors that contributing to a person's behavior in such way. As I mentioned just now, doesn't mean your category are not inside the DSM. You should not seek help. You should seek help other way because it is not healthy.
Like King's College England, they have actually done a research to show that there are 5 certain personality traits that might tend to be more associated with eating disorder. I think one of it was perfectionism. So individuals tend to really strive for perfection, and they very often go into eating disorder because that gives them that sense of control, that they can do something about it and then they can see a result. So that gives them a sense of control. And then there was one that is rule driven. So they get obsessed with following rules, and it really gives them that sense of satisfaction.
I guess basically it's the preoccupation on body image and also how much you're eating. I would say that is actually one quite distinct factor that can make a person at risk of having eating disorder.
It is very common among female, especially young adults or adolescents. But there are also cases in males, whether it's younger or older males. And it is also another group that is also quite common is also in athlete group.
So eating disorders can affect anyone. It affects men as much as it does women. I think there is a slightly higher percentage of it occurring in women just because women are presenting with it more. I believe with men, and I think this is the thing with mental illnesses in general, men seem to feel like it is not as acceptable for them to come forward and report that they are struggling. So men would often compensate with things like working out excessively due to their fear with regards to their body image. And that's sort of something that people don't notice because guys tend to like to work out. So I believe it's something that can affect both men and women in equal measure. It does affect a lot of teenagers, of course. That's sort of probably the bigger demographic. Unfortunately, I don't have the actual statistics off the top of my head. But it does definitely affect teenagers more commonly, I believe. Does it appear in children? Yes, but usually as some type of a control behavior. So with younger children, because they're not often in a position to be able to make big decisions about their life choices, the only thing they can control is the food they put in their body. So you'll see kids being very picky eaters, not wanting to eat, maybe even refusing to eat certain foods of certain textures or things like that, or sekejap nak makan, sekejap tak nak makan kind of situation. So we wouldn't go ahead and call that anorexia per se, because of course in order to fulfill the criteria of being anorexic or bulimic or having an eating disorder, there are certain medical thresholds that you need to meet, like your BMI and certain things like that. But it is something that can affect their eating. So yes, eating issues can be present in a younger demographic, but usually things like eating disorders per se would normally start to manifest in sort of the young adult or teen community.
Obviously, the more common ones that we know of are like maybe young female teenagers, or like, you know, young adults, you know, who've just maybe in university or they started work. But I think what we don't see is it really happens a lot among the males as well. And it's not necessarily young, you know, there are a lot of them that are actually older. I've actually met one that she's a mother of 3, she's in her 40s, and it's really sad how it's, you know, everyone's not as aware, so it makes it even harder for them to kind of come out to ask for help and to go for treatment.
Usually what common stigma that they would do is because of how society perceive them, even if they are underweight or overweight, how society perceive them and how society input their views on the individual. For example, if you keep on saying like this is your problem, like you yang tak tahu control makan, atau you tak tahu macam mana nak agihkan portion and everything, so then orang seseorang tu akan ingat like, oh yeah, this is my fault, so I'm supposed to find a way, I'm supposed to do one. So when they have this kind of perception, for them like macam, you know, I'm either going to get a gym coach or I'm going to go for a gym, I'm going to go for a walk. So, but they don't know that this is a disorder. So meaning the weight, the body weight increasing or decreasing is the surface of it. So they have to understand the causes of this eating disorder. Like I said, it could be genetic. There are studies shows that a twin study where they were separated and adopted differently from different family, and then what happened is that this twin have eating disorder, and there's 50% likely the other twin might get an eating disorder. So it could be genetic as well. It could be environmental factors. For example, how you grow up, like how you grew, what's your experience, what have you gone through in your life, that could be contributing to eating disorder as well. So when a person, especially our culture, when there's no limit when it comes to asking people like, or telling people like, oh, you gain weight, and once you see someone be like, oh, you gain weight, oh, you're really big, so by just saying that, it affected that person deeply. They always give their comment about it but never give solution. So these are the one of the reasons why people usually don't seek for help.
So macam I think that's the reason why macam orang tak berani nak come out with their issue, sebab dia rasa macam, oh, kalau aku cakap pasal benda ni mesti aku akan kena kritik dengan orang, mesti aku kena judge dengan orang. So the judgement itself lah yang paling teruk, I think.
Side effects of eating disorders vary, okay, depending on the type of eating disorder. For bulimics or anorexics, it may be different. For binge eating, it may be different. For example, people who are bulimic, Some of the common things would be things like teeth decay. You can see their teeth decaying. Ini disebabkan oleh acid daripada perut dia orang, ya, akan naik bila dia muntah-muntah. So you see the teeth decaying. Throat. Bulimics would have throat issues as well because of the constant vomiting. Those who are anorexic, you would find them excessively exercising, very picky about their food, and odd behavior. For bulimics or binge eaters, they like to eat lots of fatty food, carbohydrates. Binge eaters will eat a lot in a very short time. Tiba-tiba you tengok dia orang makan sampai sakit perut, sampai buncit, sampai kulit dia pun kembang, ya. It's painful. These are some of the common symptoms. Another thing would be dia tak suka makan depan orang. Dia ambil makan dia sorok, dia sembunyi. Dia tak tunjuk orang apa dia makan, ya. Sebab dia takut orang akan komen. After eating, they disappear. They don't sit on the dining table because they go and vomit, or they go and hide. They don't want people to see, or they throw away the food. Some of the common symptoms lah.
Depending on the categories, for example, anorexia, bulimia, and all that, they affect your health in a very comprehensive way, because with a drastic or with a very low weight, weight loss, you get a lot of side effects. Mostly when you have weight loss that is drastic, you have muscle weakness. Basically, you lost your muscle, so you lost the strength. And then you have poor circulation because you're not eating that much and there's no muscles. You feel cold constantly, yeah. And your skin is dry, yeah. You become dizzy, you get constipation, you get bloating, and then of course it will disrupt, like for example for female, it will disrupt your menstrual cycles. I've seen patients who have no periods at all, even after gaining some weight throughout the therapy for 2 years, yeah. So that can actually affect fertility, especially for female. The worst that I've seen, well, not during my practice, but during my clinical training, I've seen patients or teenagers being admitted to the hospitals needing tube feeding via tube, so that they could continue to survive, to live, because they really are not eating orally when we tell them to eat. So I think this is bad, because if you come to the extent where you don't want to eat, and even though you know that you're going to die when you don't eat, that's something very, very bad.
Eating disorders will damage you in a way that those other conditions won't as quickly. So the first thing we worry about is the medical impact of the eating issues. So how does it affect your organ function and your overall health? One of the main sort of concerns are things like dehydration and sort of malnutrition. So individuals with eating disorders can very quickly become very physically ill, and a lot of people do unfortunately die from the condition because of these complications.
First of all, I think we have to realize that we can't force people into treatment. Having said that, being supportive and showing that you care to people that you know who are struggling with eating disorder does make a difference. Meaning, be as open as you can to open up the line of communication, because people who struggle with eating disorders tend to struggle all this, feeling very alone, isolated. So the minimum I would say we can do, if we can't get them to treatment yet, is to show them that we care as much as talk to them about, as much as listen to them what they have to say, talk to them, and even we might not agree with things that they say. As I mentioned, our main priority is to keep the line of communication open first.
The first thing I say is just to have them talk about it, right? So I think it's about normalizing the conversation. People, I think, are afraid of normalizing conversation because they think that talking about it shows agreement. And that's not at all the case. Talking about it shows acceptance, and there's a difference. And so when you are with somebody who is clearly struggling with their eating and clearly struggling with anxiety, the first thing you want them to understand is that you are there to support them. You're not there to judge, you're not there to prosecute. So have them be in a space where they can talk to you about why this is happening to them, what their fears are. Have them work through it with you if they can. Being a listening ear can be more powerful than even having a psychology background and telling them how to overcome the problem. So that's what I would tell anyone who has a loved one who's going through it. Just be a good listener.
See, eating disorder is a disease, okay? Just like diabetes ke, hypertension ke, cancer ke, it is satu penyakit, ya. Jadi bila kita dapat tahu yang seseorang tu ada masalah eating disorder, you need to take them to the right people to be treated. You can't treat them. You can love them, you can care for them, but you cannot treat them. So try and not advise them because they won't listen. Try and not control them because they will challenge you. Okay? They'll get angry, they'll challenge you, and they'll do it, they'll rebel, they'll do worse. They'll do more things to themselves, they'll harm themselves. The best thing to do is listen to them, care for them, take them to see a professional.
There are a couple of treatments. It depends on, when it comes to therapy or treatments, it depends on what are their goals and what are they seeking for, and the individual self. Not all treatment suitable for all people, so the psychologists usually kind of like scan through that. You can do CBT, usually cognitive behavior therapy, there's interpersonal psychotherapy, there's psychodynamic. So different things, their family treatment where they actually included family in the treatment so that the family can help them, kind of keep track on their diet, keep track on their progress, and then kind of motivate them. And then there's psychodynamic where you kind of explore the root cause of your eating disorder. What are the root causes? Or you got DBT. DBT is basically tackling your behavior. And then acceptance, ACT could also be like macam accept your behavior and try to change through your behavior and everything.
Eating disorder, as I mentioned, is not just a problem with not having enough nutrition. It is actually a mental health issue. Yeah. So the treatment of eating disorder involves a multidisciplinary team approach, which includes physician. Yeah? Usually it is detected by physician, not even psychiatrists. Physician means those when you go and do when they have problems with their health, like for example, period doesn't come, yeah? ONG specialist, for example, and then the ONG noticed that, okay, this is actually related to marked weight loss and related to eating disorder, they would refer to a psychiatrist or a psychologist. And then psychiatrists, along with psychologists, will refer to dietitians or to look into the nutrition, how food education can be incorporated into the treatment, because along with the emotions and the mental health, we also need to build them physically. So dietitians will come in to educate them about food and how they should be perceiving food and taking their calories, because they are very smart people. They know exactly about calories and they know exactly about carbohydrates, proteins and all that, especially these days when the information is readily available on the internet. Yeah? But it is a multidisciplinary team approach, and very important to include psychiatrists, physicians, dietitians, and also rehabilitation. For patients who have lost a lot of weight, as I mentioned, they lost a lot of muscle mass, they also need some physiotherapy in order to help them rehabilitate and build more muscles to function well on their daily routine. For example, walking and all that.
For those people yang struggling with this issue, I tahu macam it's a bit hard for you to actually come out to people, to society to talk about this, tapi I'm pretty aware that you are struggling inside, so don't worry about the stigma and don't worry about what people gonna say about you. It's all about you. Sebab you wouldn't know how it will affect you in the near future lah.
If any one of you is struggling with eating disorders and you're aware that you're struggling with one, do not hold back, speak up to anybody that you trust the most and seek help to treat this, because there's hope actually that you will recover from this. It is not something that cannot be solved, and don't think too much about the stigma of people around you, and don't think too much about the stigma that you create within yourself. So you must speak up and choose someone who you trust the most to actually share this problem, and choose the correct healthcare provider to attend to your concerns.
To really make them know that they are not alone. There are a lot of people suffering with eating disorder, and it doesn't make you any less. It is really difficult to really start talking about it, but really the first step is probably to find someone that you can really trust, and you don't have to go for therapy immediately. You can just start talking about it, and see, sometimes you could even realize things on your own.
Treatment can be scary, but it's worthwhile.
You're not alone. I think if you were to look it up and if you were to even go on social media, you will realize that the community of individuals who are affected by eating disorders are a lot larger than you think. And to feel like you're the only person who's going through it is completely untrue. Even if the people around you might not replicate the fears that you have, we are all here to listen. And the road to making things easier on yourself starts with you speaking up about it and you asking for help. And there's a lot of help available.
If you are struggling with eating disorder, just know that you're not alone. Seek help as soon as possible. Even for the slightest change that you notice within a month or two, just seek help. Just check in with a psychologist or psychiatrist. There's no harm in that. There's no shame in seeking help as well, because sometimes seeking help is just for our self-growth. So don't just think that there's a problem with you. It's also for your self-growth. And always for people that are around other people with disorder, just check in with them. Check in with people around you, see if they're good and everything.
If you feel you have strange eating behaviors, okay, from the beginning itself, get help. Jangan tunggu sampai benda tu jadi satu ketagihan, ya. Atau sampai benda tu affects your brain and your mental well-being. While dari beginning, dari awal, kalau you rasa you tengah sorok-sorok makanan you tengah start muntah-muntah, ya, you dig and vomit, this is already a sign. You can be treated. All right, don't hide it. Get help. Call for help.